All right, I'm here with Dr. Joe Maroon, my mentor, and really one of the major reasons that I'm a neurosurgeon today. He's, as I just said, an amazing person, and I want to get right into the interview. Joe, thank you so much for being here with us today.
Lee, it's my great pleasure. Great catching up with you, too.
It is. It's good to see you, sir, and it's just a pleasure to have you with us here on YouStart today. So just give us a little thumbnail sketch about why you decided to be a doctor.
Well, it was kind of serendipitous, I guess. I was playing, I had a football scholarship to Indiana University, and none of my folks or family had ever gone to college, and I was put into a dormitory with pre-meds. And when it came time, this was at Indiana University, and they had hundreds of classes to choose from, and when it came time to selecting what I wanted to take for my classes my freshman year, the pre-med said, what do you like? I said, well, my father wants to be a lawyer. And I said, but I'm not sure about that. They said, well, why don't you sign up for pre-med, and if you don't like pre-med, you can always drop down to law.
Drop down to law, that's right.
So I ended up signing up for pre-med, not quite fully understanding what I was getting into. My mother suggested that it was a good idea. So I kind of got on that track, and it was the best thing I've ever done in my life.
That's great. And then at what point did you realize you wanted to be a brain surgeon?
Well, that was when I was an intern, again, at Indiana University, and I rotated on the neurosurgical service. And I was absolutely fascinated by visiting a patient who had a bitemporal hemianopsia. And for the audience, that means somebody who can't see in the peripheral vision. And the chief resident at the time, a fellow by the name of Paul Kramer, said, Mr. Maroon, what is his diagnosis? And he did this, and he said, you can't see to the right or to the left, but you can see centrally. And I said, I have no idea. And he said, well, you should know that. It's a pituitary tumor that's compressing the nerves to the eyes. And that somehow just struck me so dramatically that I said, gee, I want to learn more about the nervous system and how you can make these incredible diagnoses in 10 seconds with a simple test.
That's right.
So again, that was another pivotal turn in my life that I made and have never regretted.
Tell us a kind of a brief summary of your career as a brain surgeon and some of the things that you've been able to do as a neurosurgeon.
Well, I started, I've had my training at Indiana, also at Georgetown University, Oxford University in England, and also the University of Vermont in Burlington. And I joined the faculty at the University of Pittsburgh. And I was with a very famous neurosurgeon by the name of Peter Janetta, who has devised many creative and innovative operative procedures. And he really helped foster me into research interests. And I've developed many techniques for operating on patients with tumors of the orbit, operating minimally invasively on disc problems in the neck and in the lumbar spine, various types of cryosurgical, freezing types of procedures for brain tumors, and also a very big interest in sports medicine, particularly concussions and the management of athletic injuries to the neck, head, and spine.
And how did that play out over the course of your career? You've had some opportunities to work with professional athletes and things like that. So how did that come about where you were able to get involved with the Steelers, for example?
Well, when I first began working with the University of Pittsburgh, the incidence of quadriplegia, paralysis in all four extremities, in high school players in western Pennsylvania was about 1 in 11,000.
Wow.
In other words, if your son played high school football in western Pennsylvania, there was a 1 in 10 or 11,000 chance he'd be quadriplegic at the end of the season.
Wow.
And when I came to Pittsburgh, I ended up taking care of quite a few young athletes. So I instituted a preventive medicine program, how to strengthen the head and neck, how to properly block and tackle. And I gave many sports medicine symposia to coaches, trainers, players, families, kind of proselytizing that it's a great sport, but it has to be played properly. And the Steelers were very interested in some of the things we were suggesting and asked me to become the team doctor, the team neurosurgeon,
Right.
which was really the first team neurosurgeon in the NFL by about 15 years. So that was in the mid 70s, early 80s. And so I've continued in that role ever since.
Wow, and that's led to a lot of work that you've done and been really a leader in the field of concussion research and science for the NFL and the National Hockey League, right?
That's correct. And also we've recently published a large series of patients who had herniated discs in their neck with spinal cord compression or nerve compression, and we've operated on these, and we have been able to get over 90% of them back to their sport, either wrestling or professional football or baseball or etc. So we've kind of pioneered some minimally invasive approaches in that regard as well.
Wow. And at some point in your career, you became interested in, on a personal level, pursuing some pretty aggressive goals within fitness and athleticism. Tell us about that, about your career as an athlete.
Well, I had a major midlife crisis, and I lost my father. A marriage came apart, and I had to quit neurosurgery all the same week.
Oh my goodness!
This was, about 30 years ago or so, and I had to give up neurosurgery. I simply, because of depression, I wasn't able to do it any longer, and I was pathologically depressed and really not functioning well, and I ended up running a truck stop. I went from doing brain surgery to filling up 18-wheelers.
Wow.
My father had a truck stop. He left that to my mother. I had to help her. So somehow I was doing brain surgery one day, the next week flipping hamburgers and filling up 18-wheelers.
Wow.
And I said, something's wrong with this picture.
Right.
And a local banker whom we owed all the money to for the truck stop called me one day and said, "Hey, Joe, let's go for a run." And I said, "Run? I can't walk. I'm 20 pounds overweight.
Wow.
I get short of breath walking up a flight of steps." "Oh, come on." So I dug a pair of old sneakers out. We went down to a high school track, and I made it around 4 times.
Wow. You were like 40 or something, right?
I was about 40, 41. It was like Roger Bannister breaking the 4-minute mile, and it took me 20 minutes. But that night, it was the first night I slept in probably 4 months. So the next day I went down by myself, and I went around 1.25 miles, then 1.5 miles, then 2 miles. And pretty soon I was like Forrest Gump running through Wheeling, West Virginia.
Wow.
People would say, "There he goes." And after about 5 months, I was intrigued by the new sport of triathlons. So I signed up for what's called a Tin Man race, which is a 9/10 mile swim, 25-mile bike, and a 10K run. And I accomplished that, and I said, wow, what a fantastic feeling.
Wow.
So Lee, this has taken me on to raising the bar incrementally every year to the point where I've completed 8 Ironman distance triathlons.
Wow.
Which is a 2.4 mile ocean swim, 112-mile bike, and a marathon.
Wow.
The last one was in October this year. But it's incremental, increasing activity, avoiding injuries. And what I was really doing as a brain surgeon yourself, you know this so well, I was manipulating my own neurotransmitters.
Mm-hmm. That's right.
I was depressed, so I was increasing my serotonin levels much better than SSRIs. My body was full of toxins from truck stop food, not exercising. and my muscle tone came back, my endurance, my strength, my energy came back, and my memory was improved. Acetylcholine that gets deficient in Alzheimer's disease, I cranked that up. So basically, through exercise and subsequently and concurrently a lot of prayer and spirituality, I was able to get back on track and get back to the University of Pittsburgh after about a year of hiatus, and began what turned out to be the most promising part of my neurosurgical career.
Wow. So really getting your body and your mind and your spirit kind of aligned really turned your life around, didn't it?
That's exactly what it was.
You know, that's kind of, as you and I have talked about privately, you know, we both had the experience of losing children and losing people close to us. And you're right that when you go through a major life change like that, it really can derail you. And for me, it came about to where I just had to say, everything's going to fall apart unless I start today to hold on to my faith and put my life back together. And I think that's what you're describing here is you have to make a decision, right? You draw a line in the sand that going forward today, things are going to be different for me.
That's right. But it's hard to get there. You and I both have been there, and you almost have to hit bottom, it seems,
Mm-hmm.
in order to. It's an existential decision, literally an existential decision, whether you want to continue to exist, and if you do want to continue to exist, at what level and at what quality.
That's right.
Get all kinds of self-destructive thoughts in that mood, and that's why I've learned that physical activity, exercise, is probably the most potent antidepressant there is. In fact, you and I both know that there have been many studies, good studies,
Mm-hmm.
comparing antidepressants, the Prozac, the different drugs used to treat depression, head-to-head with exercise regimen, 5 days, 30 minutes a week, or 30 minutes a day. Invariably, physical activity and exercise beats any drug you can give a patient for depression.
That's right, and that's clear. And even I think Daniel Amen's work has looked at that, the effect of exercise and physical activity on the brain and what it does with our neurochemistry. So you're right about that. We've known it for a long time. Go ahead.
It's how to get people to do that. How do you take the first step to start walking, to start jogging, to start the elliptical? When you're so depressed and you're down, it's like there's nothing you can do. You don't want to do anything. There's no desire to do it. And you almost have to force yourself the first few times until you start realizing cognitively that, hey, I feel better after this. And you go back and you go back. And, people say, well, it can be an addiction. Well, I don't know of a better addiction. It makes you think better, sleep better. And Lee, about BDNF. There's a hormone, a factor in the brain called brain-derived neurotrophic factor. And this particular compound released in the brain does several things. Number one, it actually increases new brain cells. You literally can produce new brain cells. Number two, it increases the synaptic connections in the nerve cells. And number three, it increases neuroplasticity, the ability to take diverse information and, like a laser beam, utilize it in a functional way. The most effective way to increase BDNF is physical exercise, activity. Wow. So, no downside.
That's right. Now, we're obviously, for the folks listening, we're not saying that there's no value in medications and physicians when you have depression or any of those things. Certainly, if you're going to start an exercise program or change your life, you need to talk to your physician about those things if you really have major depression, right? So what we are saying, though, is that you can impact your brain chemistry more effectively and efficiently with exercise and a healthy lifestyle than you can with anything that a pharmaceutical company can make. That's definitely true. Dr. Maroon, tell us a little bit too. You're not just a guy who has done research and has personally worked out. You've also been a international leader in nutrition and supplement science, and you've worked with GNC and you've written books about this. Tell us a little bit about that part of your career.
Well, it kind of goes back to the athletic history. One of the things you do have to be careful about with overuse injuries, which I've had all of them, is pain in your joints, accidents, injuries, which come with that. There's some downside in that regard. And I was having joint pain from running so much that I was taking so much ibuprofen that I ended up developing a gastric ulcer, taking anti-inflammatories.
Wow.
And I said, I'm not sure about this. And I went to a conference, a seminar, and a fellow started telling me about omega-3 fatty acids, fish oil. And so I switched over to fish oil, taking that. And sure enough, as a joint anti-inflammatory, it was much better than ibuprofen, naproxen, Celebrex, all the things that I was taking. So I started doing research on omega-3 fatty acids, and actually my associate, Jeff Boast, who's been with me for many, many years, wrote a book entitled Fish Oil, The Natural Anti-Inflammatory.
It's a great book, by the way.
And thank you, Lee. And I started discovering a more holistic approach. So Jeff and I took 250 patients who came into my office with back and neck pain, mostly degenerative arthritis, all on drugs. All the drugs I mentioned, plus Celebrex, Vioxx at the time, that killed people from heart attack.
Right.
And we put them on a therapeutic grade of fish oil. And 2/3 of them, 60% of them, were able to get rid of their drugs that have significant side effects.
Wow.
So I've kind of continued down that path with other types of natural agents that are anti-inflammatory, and have found that many of them are just as effective as pharmacologic agents with significant downsides.
Wow. So that you ultimately were able to turn that into another phase of your career, is helping people understand that sometimes the things we can do for them as physicians aren't necessarily with our knives and scalpels and drills, but helping them understand some of the things that God already made that are available to them, right?
Well, I know how you practice too, Lee, and surgery is the last thing that we recommend for our patients.
That's right.
And we try physical therapy, we try holistic approaches, we try massage therapy, whatever it takes, meditation. Mm-hmm. When all else fails, then surgery becomes a viable option with the right indications. But I'm convinced that as you know, obesity in the United States continues to increase, not only here, but worldwide.
That's right.
We have the highest incidence of obesity in the world. And the diet, the Western diet of high fructose corn syrup, antibiotic, hormonally infused feedstock beef fed on corn, phosphoric acid laced soft drinks.
Right.
All of these things are really toxins to our body.
That's right.
We really hurt ourselves by giving into, I would say, the food industry advertising.
I think you're right. One of the problems, though, when you and I meet obese patients, a lot of times they're dealing with incapacitating back or neck pain, and sometimes they're convinced that we need to give them a pill or an operation to get them feeling better. When many times, if we can just get them moving, their body will make them feel better. So, tell me about that in your practice. When you have a patient that's significantly overweight, how do you help them outside of the operating room?
It's tough. It's tough. I learned a lesson. Many years ago, my mother, who died of a stroke, caused by cigarette smoking, was a very heavy smoker. And even from medical school, when I'd come home and I'd say, "Mom, you got to stop smoking. You're gonna hurt yourself." And every time I'd come home, she'd light up a cigarette. And, "Mom, you got to stop smoking." Finally, one day she looked me in the eye and said, "Hey, Joe, look, if you tell me one more time to stop smoking, I never want to see you again.
Wow.
I'm old enough to know what I want to do."
My goodness.
So I think of that every time I start lecturing a patient. And I don't do that anymore. People know what their problem is. It's just like individuals who develop a malignancy. Generally, they know that what they have. So you don't hit them with a baseball bat.
That's right.
In terms of what they have. And with people who are unfortunately overweight, they know it. And, I'll suggest you might want to talk to a dietitian. You might want to talk to a nutrition expert. You might want to read this particular book. And it might help you. If you don't start walking. But we know that one of the most debilitating, devastating diseases in the United States is diabetes.
That's right.
If individuals would walk 30 minutes a day, 5 days a week, they would cut the incidence of diabetes by about 45%. The most common cause of amputations, kidney failure, and blindness is diabetes.
That's right.
Who wouldn't want to walk 30 minutes a day if they could prevent those complications?
That's right.
So, it's kind of cognitive therapy. You tell people certain things, you hope they hear you, but you're never sure.
That's right. I find that one of the easiest things to do is to reorient people's goals. That you have a 50-pound excess weight or a 100-pound excess weight that seems insurmountable, probably like your first triathlon seemed to you. But if you can get people to refocus their target, like we can teach people that if you reduce your dietary intake by 500 calories a day for 7 days, you're going to lose a pound. That's the math. That's how it works. So everybody almost can cut a few soft drinks out or move a little bit more, reduce their caloric intake, and lose a pound. And if they can keep doing that, then they start seeing success. So that, I think you're right. You get people to reorient their thinking, then that produces success over time. But it's not our job to preach to them. But for the folks out there listening, what do you have to say about how being significantly overweight affects your brain chemistry? How does it affect the way our nervous systems work?
Well, it affects it profoundly. We know that being overweight leads to hypertension, leads to insulin resistance, leads to the deposition of more fat, and also leads to cardiovascular disease. There's a direct relationship between cardiovascular heart disease, coronary artery disease, and Alzheimer's disease, and dementia.
That's right.
So, again, by injudicious lack of exercise and diet, you're directly impacting the function of your brain and the neurochemistry thereof, with memory impairment, loss of plasticity or quickness of your brain, and difficulty remembering and processing information.
That's right. So we have a direct connection really between our physical health and the function of our nervous system, and we know that. And so over the course of your career, Dr. Maroon, you've helped thousands, probably dozens, tens of thousands of people become healthier and feel better and ultimately be happier because you're not just prescribing it, but you're living it in front of us. And I can tell you, folks, Joe Maroon is the reason I'm a neurosurgeon today. He created the program in which I trained, selected me as the first resident that he trained there, and really gave me my shot at being a brain surgeon. And this man, you should read his books, you should follow him and see what he's done in his life, because he's a guy who, when he says it, he backs it up with action. And so Dr. Maroon, I want to thank you, from the bottom of my heart for giving me my career, but also for teaching me that, you don't know this probably, but Dr. Maroon was one of the first people that ever walked out to me the idea that you can be a scientist and be a person of faith.
I really do appreciate that, but I have to say that the student has become the teacher. And I really mean that. I've read your book about your experiences overseas, your depiction of an extremely sensitive depiction and writing of the terrible, terrible, catastrophic injuries you managed during your stint in the Army or in the service, and the humanity you brought to these people with terrible gunshot wounds to the brain, the chest, the legs blown apart, and you've helped put them back together in a very caring way. And you should tell them about your book, and it's must reading actually for anybody who has any interest at all in what's happened in Afghanistan and Iraq and the trauma that our troops have experienced, and why this VA thing is such a huge factor. You've captured it as well as anybody I know.
Well,
in terms of the war experience from the eyes of a compassionate physician.
Well, I really appreciate that.
Thank you.
Thank you. You're welcome. And as I said, and Dr. Maroon endorsed my book, and one of the reasons that I wrote it was to tell the stories of what those people have gone through. But the fun thing about being a mentor and being a person who trains others, right, is that you can have an effect on countless people down the road in your life. So you and Dr. Wilberger and the others in Pittsburgh, they're really, your hands were on those soldiers. So thank you for training me and preparing me to be there. So
I love the way you say that, Lee. Thank you.
Yes, sir. Well, it's true. And I appreciate you taking your time. Dr. Maroon's a busy man. I want you just to give us a real quick sketch of what you're doing now. Now, you could have retired a long time ago. You've had a very successful, I don't mean but because of your age, I mean because your career has been so successful that you really could have done whatever you wanted to, but you're still operating and taking care of people. Tell us what you're doing today.
Well, I'm very interested in stem cell technology, Lee, and we're in the process of designing a study to use human stem cells to possibly regenerate degenerated lumbar discs.
Wow.
And we're putting a protocol together to do that. The other thing I'm very interested in is a thing called the ketogenic diet. Mm-hmm. It's a dietary approach to the most malignant of brain tumors, the glioblastoma tumors. There's very good laboratory and some clinical evidence to suggest that a patient who is on a very low carbohydrate and very high fat, good fat diet can literally stop brain tumors in their tracks.
Wow.
We're looking to do a IRB approved protocol here at the University of Pittsburgh to look into that, and then we're also evaluating biomarkers for concussions in athletes. So these are some of the fun things I'm looking into and working on, and find more creative time now actually than I did 20 years ago. So I've been very blessed. God's been very good to me, and it's all about giving back as much as we can.
That's right. Well, that's really profound. You're a person who's been through major life change. You just told us your story of how your career really came apart when you lost your father, and so I guess in closing here, because I know you're a busy man, but in closing, give us sort of for the listener out there who may be encountering some problem, whether it's being overweight or a career lifestyle change, losing somebody. Give us your take, your best advice for how somebody can really accomplish that major change that they need to get to where they want to be in terms of being healthier and feeling better and being happier.
Well, again, I go back to my mother. She had a great saying. She said, "You can travel the world over in search of happiness, but you find it not unless you carry it within yourself."
Wow, that's right.
So it's about finding it in yourself, not from outside. And that requires, I think, quiet time, contemplation, meditation, prayer, where you really look at what's important in life, what's of value when it's all boiled down. And I think prayer, meditation is the first. Physical activity and diet are clearly right up there with it. And then managing your work. I a couple times in my life, totally dominated by my passion for my work to the exclusion of the things that I've just mentioned. When that happens, you end up getting way out of balance. I'm actually working on another book entitled The Square, which is an address I gave many years ago to a group of neurosurgeons on how to balance your life. Mm-hmm. And it involves getting your work in the right priority, paying attention to the family and social aspects of your life, spirituality of whatever your choice is, and the physical aspect of conditioning your body and brain. So those would be my summating points, if you would.
Wow. So reach for balance, and the best time to do that is now, because we don't know what's going to happen tomorrow. Joe Maroon, you've had an amazing career. You've made an amazing impact on me and on thousands of others, and I really can't thank you enough for taking your time to be here with us today.
My great pleasure, Lee, and I'm so proud of your work and what you continue to do, touching the lives of so many people. Thank you.
Thank you, sir. Folks, Dr. Joe Maroon, thank you so much. Have a great day, Doc.
Okay.
God bless you.